My name is Mohammed Al-Hudaybi. I'm a consultant obstetrician and gynecologist, and I'm very delighted to welcome both my colleagues, Karen and Mary, both midwives who I've worked with in Bristol. Karen and Mary, would you like to introduce yourselves?
So my name's Karen, I'm a midwife in the UK, and I currently work with complex cases of pregnancy.
And I'm Mary, I'm a midwife on labour ward, and I meet women and support them in their final labour journey when they meet their baby.
I think people are familiar with the role of doctors and obstetricians here, not so much with the role of midwives. How do you think midwives affect the journey of labour, the journey of pregnancy rather, for women? And for families, for that matter?
I think it's a role that I've done for a long time, and it's really, our whole focus is on women. We're supportive of women. We empower women. We're very pro-women. Mm-hmm. It's what we do. It's our speciality. We've done it for a very long time. And I think one of the roles I have on labour ward is that I meet someone probably for the first time, maybe, in labour, and how you make that connection. It's really important to make that connection with women, with their families, to make them feel at ease. Because as we mentioned earlier, women are scared. They don't know labour is the big unknown. So I think it's just good to make a connection with women, and I think that's really important, and we've done that for a long time.
So I see pregnancy and birth as like a flower, and so you have your flower head, and you have the sepals that support the flower, and then you have the stem. The role of the midwife is the sepals that support the flower to bloom, and but it also connects to the stem. So the midwife's role is to support that woman to flourish and grow and bloom, but also to have her connected to all the resources that she needs to be able to travel through her pregnancy and birth safely. And so the midwife needs to know all of her guidelines. She needs to know what is out there. She needs to have a good relationship with the obstetricians so that she can deliver safe and good care to that woman.
In settings where midwifery is not really present, the antenatal journey seems like it's appointments, it's scans. How is that different if you introduce a midwife into that mix?
It's about relationship. So being able to walk alongside a woman through her journey enables her to ask questions, to be able to have a fuller understanding of what's going to happen and why it might happen. So even when pregnancy doesn't go so well, if you've got a midwife alongside you, so my job is very much walking alongside women where pregnancy hasn't gone quite as they hoped it would. But having a midwife means that they can ask questions and they've got someone to support them. And then they have a more positive experience through their pregnancy and birth.
And is it the same in labour as well? If you think about how the journey is without the midwife, and how is it different to the midwifery team in labour itself?
I think it's so important to be a midwife with women in labour, because we can plan as much as we can. We can have thought a lot about the antenatal education. We've shared the information. Sometimes we just don't know how labour is going to be. It's so individual for everybody. So I think as a midwife, it's really important for me to be aware that what happens if the plan doesn't go, the plan that women come in with and they think it's written in stone, and that doesn't happen, and that goes awry or it changes course, and it's just really important to have the confidence to say things to women, to have a conversation, to have a meaningful conversation, to go over the information that they've known, and then just explain to them that the purpose of me being with you in this labour is to continue on that journey. Hopefully you've developed a rapport with them, a trust with them, and they get the vibe that I'm confident in what I'm doing, I'm experienced in what I'm doing, and that I can have lighten the mood sometimes, because it is quite tense. So just incorporate their partners, listen to what they've thought about, what they've invested in, and just try and we don't have to change everything, but we can adapt to some things. It's just being adaptable and just listening to them and let them know that they're being heard, they're in control, and sharing that journey from them to say, well, it may not work like this, but we can do this. And eventually when we want the same goal, they want the same goal, I want the same goal. I want this baby to be born safely. I want the woman to be safe. I want the family to be safe, to have this new baby there. And really for the partners to include them, because they're there and they're supporting journey the whole way through.
I'll play devil's advocate for a minute here.
Go for it.
And I'd say, okay, all of those roles could potentially be played by different members of the team. What makes midwifery unique?
What makes midwifery, it can't be done by all those things, thank you. It's because we stay with women the whole journey. We're with them in labour, and if they come in when they're 1 centimetre dilated and they deliver the baby in 20 minutes, if they come in when they're 5 centimetres dilated and deliver in 20 hours, we are there the whole time. And it may not be me, maybe the next shift, but we are walking along, as Karen said, with those women. And you as doctors won't be.
They definitely won't.
Yeah.
But Karen, I know in your role you do a lot of care for caesarean sections and elective caesarean sections, but also we work together in the complex caesarean section team. That's a different journey, isn't it?
It's a very different journey, but it can often be very frightening for women. So to have a midwife alongside her makes a massive difference in having someone who can be her advocate, because the midwife's role is being an advocate for a woman, being that bridge to that, like I said, with being the stem, the joint to the stem, to be able to access those resources. So when she's having an appointment with an obstetrician, she might not be able to ask all those questions, but she might then later on, because she's got a deeper relationship with her midwife, she'll be able to say, oh, I didn't understand what he said. Can you help me understand? And that's the difference, just being able to journey with a woman for the whole length of her pregnancy.
And I suppose we spend a longer time with them, really.
Yeah.
Yes.
We call you when we need you.
Yes.
And those are the decisions that you make, and this is the combined shared decision makings that we have, but we are with women longer.
And what would your role be in theatres?
So in theatre,
Yes.
The midwifery aspect, obviously we're not delivering the baby in the same way you would with a vaginal birth, but we catch the baby as it is delivered,
Yes.
and then we can help with assessing that baby to see if it needs any resuscitation. We can carry out resuscitation, and then we're really big advocates for skin to skin, and supporting that woman through quite a difficult bit when she's had a spinal, and in recovery we then can keep the baby with us, and that I think is probably something really important, because they've been through a major operation. Caesarean section is a major operation, and it requires a skilled practitioner to be able to offer recovery and carry on those maternity skills of helping with breastfeeding, assessing all the things that we need to do as a professional, but it's all in one package with us as a midwife.
I think additionally what I would say is that it's not our baby, it's that woman's baby, and she may not see that baby, she may not be the first person. Yeah, she'll see that we'll show her the baby, but then it's really the dad we want to incorporate to come over to see the baby, because the mum is in theatre and, strapped up and just in a surgical position. So I think it's really important to incorporate the dad into that. And then also anything that we do, we want the mum to see that baby, for weighing the baby or doing anything with that baby, that mum can see that baby and know it's their baby, and that's your end journey. That's what you've, achieved.
I mean, midwifery is about the whole family as well.
Yes.
It's not just about the woman. It's about the partner and husband being part of that, and being able to involve him. So I always involve the dad in theatre.
I've seen that firsthand.
Yeah.
Yes.
So I always involve them, and I always try and encourage them to cut the cord and be involved in the baby check and weighing and all the rest of it. It's really important to have that the dads feel that they're part of that journey too. And if it help them be connected to their baby.
I think you've both been involved in lots of emergencies.
Yeah.
And I think one of the main instinctive fears one would imagine for someone to go for a normal delivery is that unknown, because it could go one way and then suddenly it suddenly changes. In the emergency, lots of us, especially obstetricians and doctors, even midwives, might be task focused. There's a part and there's a role about, in theatres, in that emergency, about overseeing all of this. Is that something that you encounter on a regular basis, and how do you manage that?
Well, before they get to Karen, sometimes I would come across that on labour ward. Everything was going fine. The baby's heart rate plummeted. There was some problem. There's an emergency to transfer to theatre. And sometimes I think, although I'm maybe the most senior midwife there, the midwives who've looked after that woman, they're carrying on going with her to theatre. And I'm trying to kind of incorporate and, just keep a connection, keep that eye contact with that woman to just say, I'm here, we understand what you're doing. So sometimes everybody can be task focused, as you said. There's lots of people, it's a team, lots of people have different roles. And sometimes I always think to myself, am I doing the right thing? I'm the most senior midwife, but I'm doing the most basic thing. And I think that's sometimes just holding that connection with that woman, to see that eye contact, to say, listen, and go with her and talk to her as the journey goes on, or when you're having your baby, or get a little running commentary as things go. And it's just really reassuring that they look at us and you, and they see that we're all calm. We come together as a cohesive unit. Yes. And I suppose in some ways, like when I had my child, you have to give up trust. You give trust to these people around you. And that then you believe in them, and you see what's going around with the colleagues are working together really well. And you think, well, actually, some point, I can't have control of everything. And I cannot do my job without you. You have to physically, surgically operate and do the baby. So it's just all of those things together that come together to make a team, to make it valuable, and to make the situation calm and keep going. And also at the end of it, to empower women to say, listen, you did this, you did most of this. It's not just about you it's not just about you.
I like to think it is,
so,
but I know
exactly.
that.
Yeah, I know, but I just think we always give that back to the woman to say, listen, you did really well. You as an we're a tiny little bit at the end, but really you've done a great journey. And just to really empower and encourage women, because you don't want them to go home thinking, I failed. Yeah. And when they're, all of us, whenever we had our children, we didn't know how to look after children. I mean, we were there with this little bundle thinking, what are we going to do? And if you go home and feel, I wasn't supported, I wasn't listened to, I felt completely out of control, it was just all rushed and it was horrible, then you are going to feel a failure. And that's really, I really feel passionately that we need to leave the woman with a positive experience, regardless of where her birth is, to say that you did the vast majority. We were just a little cog in a wheel at the end helping you, but you did the vast amount.
And is that the same in complex cases? And it is really sometimes intense in theatres, and there's a lot of people, but there is that necessity for someone to keep the patient as a human being, not just as someone being operated on, to keep that in focus.
Yeah, so there's a lot of work that goes on before we get to theatre. So there's a lot of conversation about how many people are going to be in theatre, what it's going to look like in there. Because in a complex case, there are a lot more people than there would normally be. Mm-hmm. And it can be really overwhelming for those women. And so I do a lot of discussion before we even go to theatre. And then in theatre, I'm always there. And I wear, it sounds really silly, but I wear a hat that's very recognisable.
Know that hat.
And I also, it sounds even more ridiculous, but I've had lots of patient feedback about my perfume. Yes. That actually, just being able to smell that I'm nearby is really important. And lots of them have said, I knew you were there because I could smell your perfume. And so I always wear the same perfume, which sounds ridiculous. But if that's something that works, then I'll do it. Because actually it's really frightening to have a baby in a complex setting. And so all the small things add up to making that journey more positive.
think also from experience I have in labour ward, if the woman has a complex outcome, she's lost a lot of blood, nothing like your complex cases, but lost a lot of blood, or it's completely out of what she was expecting. I just don't think you could, as a midwife looking after someone in that high dependency, as we call it, a lot of observations, a lot of checks and make sure everything is okay. Collaboration of a team. I always think, when you look after women, it's the small things. It's you can never underestimate how helping someone brush their teeth made them feel better, or any little kindness. It is important to be kind. It's important to not rush them. Okay, if they're there in labour ward for another 6 hours and you, the obstetrician, wanted that bed, or you just kind of think, well, actually, I can't push woman. She needs that kindness. She needs to keep her catheter in a bit longer. She needs this a bit longer. So it's just understanding and giving them time to assimilate what the experience has, because I do think that will absolutely count dividends towards when they are ready to go to the ward. They're ready to go to the ward in a completely different frame of mind, and the people that cared for them were kind to them. You as the obstetrician were coming in and you'd debrief them, and you would also, your team would come and they would say, they'd all say nice things and positive things to them, because it doesn't cost anything to be kind, and that will stay with them.
Thank you.
Women, remember how you make them feel.
Yes, of course. Yes. What's the, for a setting that does not have midwifery, what would you tell the people who run the system, but also what would the advantages of having a midwife be? A system that has run for decades without midwifery would probably not know the advantages of having a midwife. They're quite used to what they're doing. It works for them. What would make them change?
I think demonstrating a compassion, a continuum of someone who knows you. She doesn't have to repeat the same story to everybody. Well, maybe she sees you every day, but someone to see her every day, or someone who could connect with her, that her story is not to be repeated. She doesn't have to say to 20 people today, this is what's happened to me, I'm worried about this, I'm worried about that. Whereas if you have a continuity of, and I think, like a kind of a friendly face, a compassionate person, I think the dividends to empower women in this time, there's a short window of a woman's life that there's a lot of intensity, for that 9 months, that can pay dividends to their future health.
Yes.
And whether they might see you as a gynecologist later, or whether they might have to see their baby going somewhere, like all those things, if you empower them and give them that intention, I think being compassionate and being kind and having some continuity would be helpful. And I think midwives having that passion themselves for being with women is really, in a different way than you can save a life. Of course you can save a life. It's, but it's an immediate thing, whereas we kind of go the long road with them, if that makes any sense at all.
It does.
At all.
There's lots of advantages to having a midwife. From a personal level for that woman, she'll have a midwife to journey with her, be her advocate. So it helps promote informed choice, which is really important when you're birthing, that it is informed choice. If you decide to go outside of what our guidelines are, then it's really important to have someone explain to you why that isn't a safe option, but then be supported in those choices. On a bigger scale, the cost of a midwife is much less than obstetricians. So for the NHS, it's we're staffed by midwives, and then we have overseeing obstetricians that come on when we need them. So the cost is less. But I feel that having, for a woman coming in labour and having a midwife to look after her and be her advocate and journey that journey, and most women only birth kind of between 1 and kind of 4 times. I don't know what your birth rates are in Egypt, but in the UK, most women have 2 babies. And so those journeys are really important, that we get it right. Those experiences, we want to promote positive birth experiences for women. And that is really important. It's really important to me, and it's really important to most midwives, that we give women a voice and that we advocate for them to have the experience they want.
Thank you. I'm going to ask you a personal question. What is the best compliment that you've had as a midwife?
I've had a few. The thing that really struck me actually was I was coordinating, and I came in to welcome a woman into the room, and I said to her, the midwife, your allocated midwife will come, I'm just coordinating and leading labour ward. And she said to me, I met you broke my waters but my last baby. And I was thinking, I met her for 20 minutes and she remembered me. So you kind of think, I think it's about making that connection, and it's about whether it's me with some humour or with some welcoming, whatever. I just think you can never underestimate what impact a little thing, it can just be a little thing, or you know, those small things make a massive difference. And I was quite shocked to think, actually, I met you for 20 minutes. I broke your waters. I couldn't remember you, but you remembered me.
Yeah, I think mine is, I looked after a lady who was quite difficult to look after. And afterwards, she said to me that I was her guardian angel. And that was really special because it meant that I'd made a connection with her and that she felt that I was her advocate, but I was also there to protect her. You've worked in the UK and in Egypt, and you've worked alongside midwives, and you've worked without them. How do you see the differences, and do you think there's a benefit?
That's a very loaded question. And I have to say, of course I see the benefit. In every step of that journey, there is so much weight that is carried by an obstetrician that sharing that weight is more than welcome. You think about the number of tasks you have to think about for that safe delivery. And we are trained to think about it with a medical lens. So what, like, is the patient anemic? Are they safe to be anesthetized? And what if this happens? And is the baby well? You are looking at it from a purely medical point of view. Of course, there's a person behind all of this, more than one probably, a whole family. And as Mary was saying, your in that family will have a long-lasting impact. Support is much welcome in that setting. So whether that is in the antenatal period, where lots of the education, and that definitely has a huge effect on how they come to labour. When they're in labour, as you said, in the UK setting, it was quite different because there would be, I mean, on a good day, 9 midwives and 2 obstetricians on a shift, not so much the case in every shift. Our efforts were very well utilised. You would call me in when you needed me, you would call me in to do what I was trained to do, deal with an emergency, assess a situation, help in time-critical fashion. But I always knew that the patients would be safe and the families would be safe. Of course, your presence made a massive difference. And of course, it made their lives much easier. It made my life much easier. Having you there for them antenatally during a complex cesarean section, looking after the baby and afterwards, that had a massive impact. And as you said, those patients probably would remember you more than they would remember me. I know there are lots of complex matters that are in play here, but that role, I think, is a gap that needs to be bridged. I think that ties quite neatly to the next part, which is teamwork, because some would be worried about different roles working well together. So I'm just interested in your professional view and your experience. How does that work then? How do we work?
I think for me personally, I can't do my job without you. I can't do my job if the floor in theatres is dirty and we need a cleaner or we need a porter to get women to the ward, and we need another labour person coming in. So I just feel it doesn't matter how big a role is or small a role is. In the cog of wheels, we need everybody. And I think, it's again like that education as well of, I don't know everything. You don't know everything. But I feel confident in where I work to say, there's no question too stupid. If the junior person wants to ask me a question, if I need to ask a question, I need your expertise as an obstetrician because you know some medical thing that I may not know. So I think it's just having that confidence and that security in knowing that we've built a team and that we're all as equal as each other. I think that really enabled me to grow as a midwife. It probably enabled me to think of cases or, you know, scenarios, or gain medical knowledge as well, actually, because, you know, you can be running around doing 50 things and I need to say to the junior doctor, well, actually, Mo's busy, but he'd like you to do this, 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 and this. I think, and that's just, it's kind of seamless. And I think that's really important too, that we are here every single day for that woman.
Yes.
We're not here for our egos.
No.
We're not here. I don't need to deliver a baby every single day to be remembered. I'm not interested. I just need to know that the people I worked with had a good shift, and that we all staggered home and the babies were safe and the women were safe. So that's kind of what I need to do. So I don't really have an ego about anything. We have to work well together, be civil to each other, and continue to develop those connections.
One thing we've done is train together as well. So we do a lot of training, multi-professional training together. And that is really helpful in building relationships and looking at possible scenarios that could happen and then working through how you deal with them safely. And that's really helped make labour wards safer.
How does a good team manage those disagreements? And how does the patient feel if they know that there are disagreements and we're managing them?
I think you have to be professional. You can't be shouting in front of the patient, the woman. You can't be doing that. I think you have to, you have to be a really good listener. You have to leave your ego at the door. I may not necessarily agree with you, but in what you've responded to me with, I think, I have to be big enough to say, well, actually, your idea was much better. And I've learned from that, hopefully. And then you may have learned from how you spoke to me or how we shared something. And I think you have to be professional. You have to think of why you're there. You know, you're not there for you. You can go and get a different job somewhere, or we can all go and do different things. But we're there. It's not an easy role. It's not an easy job. It's fluctuating with highs and lows over the course of, we're going to see some triumphs, we're going to see some disasters. But I think if you know that you've given your best and you've met your best with the best of other people to do a better job, then I think you're halfway there.
And how they were managed well?
Well, I think, like Mary said, never in front of a patient, always behind closed doors, and falling back on guidelines. Because we have quite good guidelines to fall back on. So sometimes there might be someone that thinks they're definitely right. And then you can fall back on a guideline and say, actually, this is what our guideline says. It's research-based. So actually, you're wrong. But it's always respectful.
Yes.
You never say, I told you so.
How do midwives feel about working with obstetricians?
I like working.
I work where I do because I work in a team.
Yeah.
I drive past a few hospitals to work where I do. And I think like I said to you before, I probably knew you as a junior doctor, and then you've come as a registrar, and now you're as a consultant, and you think you remember those people. You remember your life course, or how did you get on? You pick up where you left off, and that's what friendship is, isn't it? And that's friendship in the workplace, and it's mutual respect, and I think that's what gives us the positivity to do what we do.
I don't know, you've summed it all up really. Like Mary said, where we work.
It's connection, and it's how you maintain connection with the staff you're working with and how they work together, and the connection that we make with women and partners to make sure that their birth journey is the best it can be.
I always feel that I can do my job well because I know that when things aren't going quite as well, I've got someone to fall back on and have support from. So there's always, you guys as obstetricians are very knowledgeable. You know how to resolve problems when things go wrong, and you can help us. And my job is to tell you soon enough when there's a problem. And so you have to trust me as much as I have to trust you. So you have to trust my practice that I'm not going to get things to a point where actually you can't sort it out. So that it's a mutual respect and mutual trust that we can work together.
We are not the only doctors you deal with when it comes to looking after women. You also deal with quite a few others, like pediatricians and anaesthetists. Is it the same working relationship?
I think for me on labour ward, and probably, well, especially for you, me and labour ward and you and theatres, I'm sorry, but they walk on water. They're fantastic. You know, they really bring to the team that they can take someone's pain away, and you can't do that, man.
No, you can't.
No. So we have to appreciate that, and also
Yeah.
I think in our teamwork and how we review sick women and high dependent women, you know, we do it in a very systematic way, and their input is really good. And I think pediatricians, if you're thinking about you're going to deliver this baby and those very tricky decisions, do you deliver, do you not deliver, what's the best for those early gestations, pediatricians everybody comes into their own, and I think we respect that and we value that. Yeah. And that's how we work together.
I think one of the worries that I can imagine for someone who has no experience with midwives is that element of trust that Karen was talking about. Because in certain systems and certain settings, the responsibility falls solely on the obstetrician. And it can be quite tricky to trust someone else with the assessments, with dealing with what's normal. How do we ensure the doctors and the patients that actually what we're doing is safe? How do we ensure that certain guidelines will be met and escalation points are set from the outset, so that if things don't go right, then there's an escalation policy. And there's no, as you said, there's no ego to stop us from escalating.
It's communication with women all the way through, so they know that you've got a good working relationship with your obstetrician, with the paediatrician, with the anaesthetist, so they can trust that as a midwife you would then escalate, and that you're not going to just keep it to yourself, because actually it's about them. You're their advocate, and that is how we should promote midwifery, that we're the advocate for a woman.
I think what I'm hearing about all of this is what Mary was alluding to earlier, is that having a vision, knowing why we're doing the job that we're doing, keeping the patient at the center of it all instead of ourselves, seems like an easy task, but is it really?
I think you need to go back to sometimes you need to go back to the academia, in that, you know, we always talk about these early adopters or these late adopters. And I think you have to be, if you want to, and change management, all those things that we did at uni, and you think, oh, but actually it's helping to understand. You have to plot what you want to do. You have to understand this could be okay, this could be a pitfall, this could be something else, and how you think about how you're going to pull people together, the right people together, to help you in that pitfall, or to help you get over that hump. And I think success breeds success, and you have to nurture a small team. And I know, I'm sure it will be quite, we all started that. We were all unsure when we started 25 years ago, when, you know, working as a team, we didn't really know what was going on. But, you know, every year we improved on what we did, or we kind of got it a bit quicker, or we could see the vision, or we could go along with it and think. And then when you grow it to that flower, then you can, like, that becomes a meadow of your, you know, all those people around you, and word will get out that actually there's good communication here, there's good birth experience here, there's good outcomes here, the women feel safe, the women go home feeling empowered to raise their families, and they might even come back again, and you can do the whole thing again. And it's those type of things that success will breed success, but you have to have good people around you.
You guys have lived through a change in Southmead where prompt was introduced. You've seen it come, you've seen it grow, you've seen it flourish into what it is right now. For those of you who don't know what prompt is, it's a multi-professional training where everyone who deals with obstetric emergencies, be that obstetricians, midwives, anaesthetists, pediatricians, we all train together to know how to deal with emergencies. You've seen it grow. In terms of any generic team formation or team building, how is reflecting on the journey of prompt helpful? What lessons are there to take from how prompt grew and how much it's now a global advocate of women's safety and health?
I think it's seeing how it grew, and seeing how you had like Tim had a shared vision and brought in people, and kind of something sparked an interest in that person he it.
Yes.
Or something that, you know, he thought, well, actually, you're very good at doing what you do, and this person is very good at it. So it's bringing those together. And it is sharing that vision, and it's bringing it around the world. And, you know, I've worked in those situations that you've talked about, that, you know, what you want to change in Egypt. You know, I went to the Philippines for 2 years, and it was really a huge change. It was a huge change for those systems, because they didn't have midwives to the same degree, or, you know, it was a very medicalized system. But if you can show and share and say to these people, what you have is good, but what we can initiate or you can train together can save women's lives.
Mm-hmm.
And then over time, now you have to invest in it. You have to invest in it, and you have to be passionate about it. And we went back to the Philippines a couple of times over 2 years. You can actually then see the data. You have to have data to say that that hospital, the maternal death rate, the maternal mortality improved by 24%. That's
Wow.
absolutely massive. Or, you know, in some countries they couldn't have that very essential drug to stop you bleeding. But then actually, as we left, the government had prescribed it in hospital. Do you know what I mean? So I think you can get bogged down in how big it is or how big your task is. But if you start small and then grow like the flower and then grow like a meadow, then you can grow along the Champs-Elysees, if you like. You know, that big things. But I think you hold on to what you believe in first to drive it, and then, you know, bring the people along to share the vision.
Is it the same experience?
Yeah, it's all about the teamwork. It's about recognizing everyone within the team, appreciating what they do, and pulling together to support the woman who is the centre of that journey, making sure that she feels supported through what is a terrifying experience for her.
And that her life can be saved by the porters getting that blood, getting those blood projects.
Yeah.
Like, it's just everything. It's everything. It doesn't matter how small it is. Everybody makes a difference.
So do you see benefits to having a cohesive team that always works together? Or do you think that actually you could pull together as a team of individuals that don't regularly work together?
Well, that's a really good question. I think you could do both. The second one is the more difficult one. And to be able to pull a team out of thin air, you almost need everyone to work with the same manual and to have the same values and to have the same training. So it's more difficult to have people at different tiers to pull together as a team. Any teamwork is a joint venture. And that means that, as opposed to an individual task, an individualistic task, it means that there is negotiation, there is compromise, there is listening to the other person, explaining to the other person your point of view. It almost takes a little bit more energy to do things as a team. But the outcomes and the benefit of having a team are immense and massive. In the 2 years that I've done placenta accretas in the UK, the experience that I've gained, and I think the experience that the whole team has gained, I can see how we grew as a team. Because we had a forum to sit together and discuss things together and communicate together. That is the difficult part, and that's the different mental model of working as an individual than it is working as a team. As a team, you need to communicate, and so you need to have everything written down. Even if you attempt to do that, there'll be a few things that are missed, those are experienced, but try and write everything down as much as you can to be able to get people to fulfill those roles in an emergency if you don't have the original team. But having a team per se definitely makes a massive difference, not only to the patient safety, but to the level of stress that we as a team would experience. Of course, there are others who are much better than me in doing, obstetrics, and there are those who are much more experienced.
I think it's important for women to understand, and like when you share that knowledge, they'll think, oh, I've got this knowledge. Can I ask this question? Can I ask that question? And that makes you think as an obstetrician. And then they feel comfortable to ask you, can I do something different? Which they may never have done before. And that's empowering, isn't it?
Thank you both so much. It's been an absolute pleasure having
Thank you.
Thank you for having us.